Right, look, I know what you're thinking. A female urologist talking about men's sexual health? But hear me out. I'm Dr. Hannah Collins, and over my 20-plus years working in men's health here in New Zealand, I've helped thousands of blokes just like you reclaim something they thought was gone for good. Today I'm going to share 3 clinically proven methods that can improve your erectile function by up to 60% in just 6 weeks. And I promise you, the third technique is so unusual that most guys have never even heard of it, despite it being used in urology clinics worldwide. Now, here's a statistic that might surprise you. 78% of Kiwi men over 40 experience some degree of erectile difficulty. But here's the kicker. Only 3% actually know about the simple exercises that can dramatically improve their situation without medication. I've spent 2 decades specialising in men's urological health, and I can tell you this is one of the most under-discussed topics in our healthcare system. Blokes are embarrassed, they're frustrated, and they're often too shy to ask for help. But not today. Today we're going to have an honest conversation about what actually works. Before we dive in, let me address the elephant in the room. Why should you listen to a woman about men's sexual health? Fair question. Here's the thing. As a urologist, I've examined and treated more male patients than most GPs will see in their entire career. I've worked with rugby players, farmers, office workers, retirees, you name it. I've seen what works and what doesn't, and honestly, sometimes it takes an outside perspective to cut through the stigma and give you the straight facts. My patients tell me they actually prefer talking to me because there's no ego involved, no competition, just medical expertise and genuine care. So let's crack on. Many guys think an erection is simply about arousal or psychology. Sure, those factors matter. Your hormones, your nervous system, your emotional state, they all play a role. But at the end of the day, an erection is fundamentally a plumbing issue. It's about blood flow. Without sufficient oxygen-rich blood reaching your penis, you simply cannot achieve or maintain a full, firm erection. This is exactly why doctors prescribe medications like tadalafil or sildenafil. These drugs work by dilating your blood vessels and improving blood flow to the area. But here's what most people don't realize. There are natural methods that can achieve similar results without the side effects, without the cost, and without the dependency. Let me give you a quick anatomy lesson, but I promise to keep it simple. The blood that enables your erection comes from your internal pelvic blood vessels. It starts in your aorta, your body's main artery. From there, it branches off through vessels in your pelvis and eventually reaches your penis through what we call the pudendal artery. This then divides into even finer vessels, the cavernosal arteries, the dorsal penile artery, and the bulbar arteries. Think of it like a sophisticated irrigation system. When everything's working properly, blood flows in with enough pressure to fill the erectile chambers in your penis, creating a firm, stable erection. But when the system is compromised, whether through arterial plaque, weak muscles, or vessel narrowing, your performance suffers, and that's where these 3 methods come in. I had a patient last year, let's call him Mike. He's a 52-year-old builder from Auckland, been married for 27 years. He came into my clinic absolutely gutted. He told me, "Doc, I feel like I'm letting my wife down. I feel like less of a man." This is what breaks my heart. So many blokes suffer in silence, thinking it's just their fault or that nothing can be done. Mike's story isn't unique, but what happened after he started these methods, that's what I want you to focus on. Right, method number 1. Pelvic floor exercises,
also known as Kegel exercises. Now, most guys have never heard of these, or they think they're only for women after childbirth. Completely wrong. Your pelvic floor muscles are absolutely crucial for erectile function and ejaculatory control. These muscles support your bladder and bowel, yes, but they're also directly involved in achieving and maintaining erections. Here's how you find the right muscles. Next time you're having a wee, try to stop the stream mid-flow. The muscles you engage to do that, that's your pelvic floor. Don't actually make a habit of stopping midstream. That's just for identification purposes. Once you know which muscles we're talking about, you can exercise them anywhere, anytime.
No one will know you're doing it. Here's the exercise itself. Contract those pelvic floor muscles and hold them tight for 5 seconds. Then release and relax for 5 seconds. That's 1 rep. Do 10 reps in a row. That's 1 set. I recommend doing 2 to 3 sets every day. You can do them while you're driving to work, watching the telly, having your morning coffee, whatever suits you. The beauty is they're completely invisible. Now, you won't see results overnight. But after about 6 weeks of consistent practice, most of my patients report significant improvements. Harder erections, better control over ejaculation, and more confidence overall. Mike, the builder I mentioned earlier, he was skeptical at first. He said, "Doc, how's squeezing some invisible muscles going to help?" But he stuck with it. 8 weeks later, he came back for his follow-up with a massive grin on his face. His wife had noticed the difference too, and they were both over the moon.
The science behind this is solid. These exercises strengthen the bulbar cavernosus muscle, which is responsible for allowing the penis to engorge with blood during erection and for pushing blood into the glands. Stronger muscles mean better blood flow, better rigidity, and better endurance. Simple as that. Method number 2, vacuum therapy, also known as a penis pump. Now, I know what you're thinking. You've probably seen dodgy ads online claiming these things will give you permanent growth or miracle results. Let me be clear, we're not talking about those gimmicks. We're talking about legitimate medical devices that are used in hospitals and urology clinics around the world. Here's how it works. You place a cylinder over your penis and create a vacuum by pumping out the air. This negative pressure draws blood into the erectile tissue, essentially forcing an erection. The principle is dead simple. More blood flow equals stronger erection.
This method is particularly effective for men who've had prostate surgery, where nerve damage might have affected natural erectile function. But even if you haven't had surgery, if you're dealing with age-related decline or circulation issues, vacuum therapy can make a real difference. I want to be very clear about proper usage, because this is where guys get themselves into trouble. Use the device for 10 to 15 minutes, maximum, and no more than 3 times per week. More is not better. Excessive use can lead to pain, bruising, or even tissue damage. Some men use a constriction ring at the base of the penis to maintain the erection after removing the pump, but this ring should never stay on for more than 30 minutes. Blood needs to circulate, and cutting it off for too long is dangerous. My advice: don't just buy some random device off the internet and figure it out yourself. Talk to a healthcare professional first. Get a demonstration of proper technique.
Make sure you're using a quality, medically approved device. I've seen too many blokes come in with injuries because they went too hard, too fast, with equipment they didn't understand. Safety first, always. One of my patients, a 58-year-old farmer from the Waikato, had a radical prostatectomy for cancer 3 years ago. His surgeon did a brilliant job removing the tumour, but unfortunately, the surgery affected his erectile nerves. He was devastated. He felt like his sex life was over. I prescribed vacuum therapy along with some other rehabilitation techniques, and within 4 months he was able to achieve erections firm enough for intercourse. He actually brought his wife to a follow-up appointment, and she gave me a hug. That's why I love this work. It's not just about physical function, it's about relationships, confidence, and quality of life. Now, method number 3, and this is the one that surprises most people, the penile extender. Very few people talk about this, but urologists and physiotherapists have been using these devices for years with remarkable results. This is a traction device that applies gentle, consistent stretching force to the penis over an extended period. Here's what the research shows. If you use a quality extender for 1 to 2 hours per day over a period of 3 to 6 months, you can significantly improve blood flow, enhance erectile capacity, and in many cases achieve measurable length increases. Now, I'm not promising you're going to gain inches overnight. That's not realistic. But the consistent traction stimulates tissue growth and vascular development in a way that genuinely works. The key word here is consistency. You need to be disciplined. Wearing the device sporadically won't do much, but if you commit to the routine, gradually increasing the wearing time as your body adapts, the results can be impressive.
Studies show that men who stick with the program see the best outcomes. We're talking improvements not just in size, but in rigidity, stamina, and overall sexual confidence. Here's what you need to know before you start. Only use medically certified devices that fit your anatomy properly. Don't just grab the cheapest thing on Amazon. Start slowly, maybe 15 to 20 minutes a day, and gradually increase. Listen to your body. If you experience pain, numbness, or discoloration, stop immediately and consult a professional. This isn't a race. Slow and steady wins here. I had a 61-year-old patient, a lovely bloke, semi-retired accountant. He had been dealing with erectile issues for about 5 years. Tried medication with limited success. He was hesitant about the extender at first, thought it sounded a bit dodgy. But he did his research, invested in a proper device, and followed the protocol precisely.
6 months later, not only had his erectile function improved dramatically, but he'd actually gained about ½ an inch in length, a notable girth. His partner was thrilled, and more importantly, his confidence was through the roof. He told me, "Hannah, I feel like I'm 40 again." Now let me bust a few myths while we're at it. Some people think these methods are dangerous or unproven. Not true. All 3 techniques I've discussed today are backed by clinical research and are regularly recommended by urologists worldwide. The key is proper technique and realistic expectations. Another myth is that these methods only work for young men. Absolutely false. I've had patients in their 70s achieve significant improvements. Age affects things, sure, but it's not a death sentence for your sex life. And finally, some guys think if they need help with erectile function, they're somehow less of a man. Mate, that's rubbish. Taking care of your health, whether it's your heart, your prostate, or your sexual function, is actually the most masculine thing you can do. Real strength is asking for help when you need it. Let me give you a quick recap. Method 1. Pelvic floor exercises. 5-second holds, 10 reps, 2 to 3 sets daily. Start seeing results in 6 weeks. Method 2. Vacuum therapy. 10 to 15 minutes, maximum 3 times per week, with proper medical guidance. Method 3. Penile extender. 1 to 2 hours daily, consistent use over 3 to 6 months, with gradual progression. If you integrate these 3 methods into your routine consistently, you will see improvements. Stronger, longer lasting, more controlled. And honestly, the physical improvements are just part of the story. The boost in confidence, the improvement in your relationship, the sense of vitality. That's what really matters. Now, I know some of you are thinking, this sounds great, Hannah, but I want faster results.
I get it. We live in a world of instant gratification. So I've put together something special. There's a completely natural, scientifically validated protocol that's helped thousands of men achieve noticeable improvements in as little as 30 days. It's safe, it's simple, and you can do it from the comfort of your own home. If you want access to that, click the first link in the pinned comment or check the description below. I'll walk you through the entire process, step by step. Look, I want to be honest with you. I've been doing this work for over 20 years. I've seen men come into my clinic feeling hopeless, embarrassed, defeated, and I've seen those same men walk out months later with their heads held high, their relationships stronger, and their quality of life transformed. That's what keeps me going. That's why I make these videos. Your body is an incredible machine, and it's capable of remarkable recovery and improvement, even if you've been struggling for years.
But you have to take action. Watching this video is a great start, but information without implementation is useless. So here's what I want you to do. Pick one method. Just one. Start with the Kegel exercises if you're unsure. They're free, they're private, and they work. Commit to doing them every single day for the next 6 weeks. Set a reminder on your phone if you have to. Just don't let this be another video you watch and then forget about. And if you found this helpful, do me a favour. Share it with a mate who might need it. I know it's not the easiest topic to bring up, but if you've got a friend who you think might be struggling, send them this video. You might just change their life. Drop a comment below and let me know which method you're going to try first, or if you've already tried any of these. Tell us how it went. This community is built on honesty and support, and your experience might be exactly what someone else needs to hear.
Next week, I'm going to talk about the nutritional factors that directly impact erectile function. There are specific foods and supplements that can make a massive difference, and I'm going to break down exactly what works and what's just marketing hype. So make sure you're subscribed and have notifications turned on, because you won't want to miss that one. Your body will thank you for taking this seriously, and your confidence as a man will reach heights you haven't experienced in years. You've got this, and I'm here to help you every step of the way. Thanks for watching, and I'll see you in the next video. Kia kaha, stay strong.